Hey everybody, Dr. Tammy here. I have the coolest new toy. It is our big whiteboard. So of course I'm the nerdy science girl and I love to draw pictures. So I'm gonna draw you just a couple pictures and be brief. But when I asked for questions the other day, somebody said I'm on Lupron, which was for prostate cancer, and I'm having hot flashes, and it was a man. And what do I do about that? And it's very interesting because men and women have all the same hormones. Estrogens, progesterones, testosterones, it's just different percentages and different amounts in their body and different receptors. So if a man has hot flashes, that's actually not uncommon during what we call andropause, which is similar to menopause in females. The thing about females, the reason we have such drastic drops after menopause with our female hormones is because we are born with all the eggs we're ever going to have in our ovaries. So we pump out an egg every month, and if it gets fertilized, well, you have a baby. So once our eggs are done and they're all gone, our ovaries literally shrivel up like raisins. And so when you don't have the estrogen to maintain the balance and the temperature regulation, it's competing with thyroid, which does temperature regulation, and all that just all gets all jumbled up. So that's why we have compounded hormones, or we have hormone therapy after menopause. Well, men also stop producing as much testosterone, and it's an estrogen competition thing, which I won't get into the details there. But as men lose testosterone, they also lose estrogen, and they can have hot flashes and night sweats and all sorts of other unwanted symptoms, lose muscle tone, lose libido, all sorts of things can go. So when you look at the way the hormones are comprised in the body, one of the things that comes up is that if you lose your ovaries in a female, or you lose your prostate in a male, or you have prostate cancer and you're no longer making the same amounts of testosterone from the testicles, then you can start to have all sorts of problems downstream with your hormones. So a lot of people think that cholesterol is just a fatty globule ready to cause a heart attack, but it's actually a steroid hormone. That's where the word steroid comes from, is sterol. And cholesterol then turns into a hormone called progesterone, all the way down here to testosterone, and then into the different estrogens. And I'll tell you something really sad that I heard today, and it really makes me hurt for the gentleman. And I'm not your doctor, I'm just giving you some ideas and perspective on things. So do not stop any medications that you're taking, or whatever your plan is. Stay the course, but just kind of think about things and ask questions. That's the biggest thing I want to do, to ignite you to ask questions. So one of the things that you have to look at is different kinds of estrogen in the body. And when people hear hormone, they shut down and they think estrogen and they think cancer, or they think testosterone with prostate, they think prostate cancer, but there's so many different variables here. And so the minute somebody gets prostate cancer, they want to completely shut down everything. Same with breast cancer. And I heard a terrifying story today. There was a patient who came to me who went to visit a world-renowned breast cancer doctor. And she's on compounded hormones from me. She's got a family history of breast cancer. And she goes pretty frequently to get checked out, and she gets MRIs of the breast, and she's followed pretty closely. And so this guy told her that she needs to stop all her hormones, and wanted to put her on tamoxifen, which blocks all your steroid hormones, which is kind of what's going on with, potentially with prostate cancer patients who are on GnH analog antagonists, which the brain in both men and women, the pituitary gland makes hormones that tell your body, either your ovaries or your testes, to make more of your sex steroid hormones. And so it's a feedback loop that happens here. So what they're doing is they're trying to block the feedback mechanism at the level of the brain. So therefore you have no more sex steroid hormones, and you can imagine how bad you'll feel. And it is literally putting them into menopause if they're a young woman, even for like endometriosis treatment, stuff like that. It's literally putting them into no hormone zone, which to me, you might as well be dead if you don't have hormones to protect you from getting diseases, to protect your brain from Alzheimer's, to protect your heart, to protect your skin, your continence, your bone. My mom died from a broken hip, essentially. So it's like you need your hormones. You don't need to block them. So again, it's a conversation. That's just one little doctor's perspective on this, and it's a conversation you need to have with your doctor. But educate yourself before you just do treatment that the mainstream pharmaceutical companies who make billions of dollars in the cancer industry want to just put you on these drugs. So anyway, it is a conversation for sure. If you're not a candidate for surgery, I know there are lots of variables, and I do have patients that through conversations, we talk about potential medications and potential chemotherapies and radiations and surgeries and stuff. So it is an individual conversation, but I just want to kind of show you that this blanket thing of blocking and cutting out all your hormones is just, it can be very debilitating. So you kind of come down to quality of life issues too. So yeah, it could be that they could shut out all your hormones and you won't get cancer for 15 years. But if you feel like crap, you know, which way would you rather go? And so there are other options. One of the things that I want to share is if you think about, sorry, I dropped my pen. If you think about who gets breast cancer, is it a young girl who has lots of estrogen or a menopausal female who has literally none after menopause if they're not on therapy? Well, it's the menopausal female with no estrogen who gets breast cancer. So something else is going on. It's like, don't, you know, you as a patient or a healthcare consumer, I mean, it's just common sense. And so you can go, hey, wait a minute, something's up here. Or a male with prostate cancer who gets, you know, who's told that we have to shut down all your hormones. But my 17-year-old son has like testosterone levels through the roof, I'm sure. And so a menopausal or a andropausal man who has no testosterone hardly when we check, his chance of getting prostate cancer with no testosterone in his body is 1 in 8 essentially. And my son, who's 17, has a 1 in like 200,000 chance of getting prostate cancer. So you think about, okay, well, if testosterone caused prostate cancer, why do the old guys with none get the prostate cancer? So there are different variables, and I won't go into all the science, but basically estrogen and testosterone convert into each other. And so when you look at what happens with these conversions, it's a problem of an imbalance in the estrogens, and there's different kinds of estrogen. So anyway, my patient was at that breast oncologist, and he said, why are you on these hormones? You need to get off of them. And she said, well, they're compounded bioidentical hormones. And she said, there's different kinds of estrogen. Now, remember, this is a breast cancer doctor who didn't know the different kinds of estrogen. At what level do they study these pharmaceuticals so much that they have forgotten basic science? They teach this in biology, in med school. And like he had to Google the different kinds of estrogen. And so I'll just tell you, estrone is a very problematic estrogen. Not God doesn't make a bad hormone, but estrone is a very proliferative estrogen, meaning it can cause growth. So if it's unbalanced, it can cause prostate growth. It can cause breast cancer or ovarian cellular growth, which can be, you know, then it becomes tumor and then it becomes cancer. So you don't want things overgrowing. If you're a 9-year-old girl or 9-year-old boy trying to grow breast or prostate, then you want those higher levels of this proliferative estrogen. But at some point, more of that, if you just keep growing, it's kind of like a broken bone that keeps calcifying over. That's not good at some point, right? So you want that process, that growth process, to not keep going like wildfire. So if these people, these doctors who are just intellectually lazy, and I'm sorry, I don't want to be, you know, knocking my colleagues, but a headache is not an aspirin deficiency. There's something going on. So when you look at these different levels, then you understand that estriol is actually a protective estrogen, and it can bind up the receptors on estrone and actually protect you. So breast cancer patients can actually take estriol, relieve their hot flashes, relieve their symptoms, and be okay, and actually be protected from estrone. Now, estradiol is a mild estrogen. We try to stay away from that because the arrows go both ways from estradiol to estrone. So what I do with my patients is I check these levels and I make sure that we're doing this very safely, because everyone converts differently. Everybody genetically converts differently. So you have to be really safe when you do this. So I think that's the reason why pharmaceutical companies are so appealing to doctors, because the management is so much less. You just throw a pill at something, and without monitoring, you know, that's the whole conversation, is just, hey, it's just this easy. And I remember in med school being really overwhelmed and having my attendings actually tell me, Tammy, just learn a few drugs and you'll make a good living. Oh my gosh. I mean, you know, it's crazy, the mentality of what, and don't get me wrong, if I break my leg, I want a narcotic. If I get an infection, I want an antibiotic. And yes, I still write prescriptions. And even the hormones that I write for are prescriptions. But there's a place for everything, and there's nutrient deficiencies, and there's so many factors going on with the hormones that you can't even, you know, have a conversation about cancer or cancer treatments or symptomatic menopause. Or what's happened a lot of times is it's an induced menopause or andropause, because once you have a hysterectomy or ovaries removed, like an oophorectomy, then you have all sorts of other issues that come up. And so if you don't know every single one of these hormones, and there's actually 25 metabolites of estrogen, and to not know that the BRCA gene is attached to estrone for a cancer doctor was just, I can't tell you, my blood was just boiling. I was so upset, and I was just like, this is why we're faced with this problem. So again, your doctor's not stupid, and your doctor's not that they don't care. It's just that the overwhelmed and where they get in life, it's just so much easier to throw drugs at stuff. And then when they have to play in with the pharmaceutical companies and play the game of seeing 60 patients a day, it does become just easier. But you have to be smart. You have to be an informed consumer, your own best advocate, and ask for the care that you need. So in a nutshell, to summarize, if you're having hot flushes, the treatment is to restore balance of the hormones, not block them out completely. And I know there are circumstances, and they're good medically based to have a conversation with your oncologist, with your doctor. If you have raging cancer and you have to do something right now, yes. Because I had a lady tell me one day she was on hormones for 2 weeks, and she went and got a mammogram, and she said, oh my gosh, I have breast cancer. You caused that. And I'm like, the doubling time of a breast tumor is at its very worst, most aggressive, is 3 to 6 months. So you've had this thing for over 60 years brewing in your breast. No, trying to get hormone balance with you in 2 weeks didn't do that to you. It might have actually helped your outcome. So I guess what I'm saying is that understanding this could literally save your life. Knowing what your estrogen levels, if you're a male or a female, could save your life. But if you're in an acute phase where we're talking aggressive cancer, yes, like, you know, I have a dear family member who had prostate cancer last year, and we were all over it. He got a total prostatectomy, had the robot procedure. You know, we were all in because we had to get control of that. But then when you step away from it, being on something that suppresses all your hormones for the next however many years is just crazy. It's kind of like when people get put on blood thinners or blood pressure meds in pregnancy or things like that, and nobody follows up, and nobody ever says, hey, do I still need to be on this after all these years? Or maybe their blood pressure is like normalized because they've lost weight, and doctors never thought to say, well, do you really still need to be on that? So it is a conversation. If you are in a place where you are on these medications, I think the bottom line is, what can you do if you're having these conversations with your doctor and you're kind of stuck because they won't do anything else besides just have you on these brain hormone blockers. There are pharmaceuticals, so if you want to play in that sandbox, there's things like gabapentin that help for things like neuropathy. It can calm some of that neuropathic sort of adrenaline cortisol pathway stimulation and temperature regulation. Some of the antidepressants like Prozac and things like that. Again, that's just throwing pills at ills. But if you're in a place where you need to be on these medication acutely for a raging cancer or something like that, and you're not a surgical candidate, all sorts of different circumstances, then it does make sense to ask for some pharmaceuticals for symptom relief. Some other things like evening primrose oil and their black cohosh, some other things can help relieve symptoms that are not estrogens. And you know, there's lots of things you can do. So yeah, I'd be happy, you know, to, if you want to message me to give you some more specifics on that. But again, I don't know that long-term blocking all the hormones really makes a whole lot of sense. So anyway, I know that was a lot of nerdy science, and I wanted to play on my board a little bit and draw lots of lines and crayon marks and stuff. But anyway, I just want y'all to be healthy and well and feel good and live your life to its fullest. And it really does at some point begin with you asking questions. Does this really make sense? And having conversations, being your own advocate. And if you're not getting the answers that make sense to you, find someone who'll give you those answers. Okay, I love you all very much, and I'll see you later. Mwah.